Our speaker before heading off to lunch is Janette Korolew. Janette has a professional background in journalism, marketing and event management, but believes her most challenging and fulfilling work came to her later in life as mother of a person with a serious mental illness. Janette has provided essential support for her adult son as he came to terms with his schizophrenia, sometimes leading the way and at other times walking beside him and behind him depending on how he is travelling. Her lived experience has led her to work in the community sector as a peer support worker where she helps others cope in their challenges. So Janette's going to talk about carer perspective and peer support perspective in the Barwon region. Thank you, Janette.
I think it's time for a bit of storytelling again just before lunch. So I'm going to give some anecdotal information from the carers' experience in the Barwon region, working for MI Fellowship Victoria. So I felt compelled to do this. As the NDIS has been rolled out, we're now seeing receiving more information from carers, and the advocacy role is really starting to come to the fore for people like myself. So yes, I shall share. So I wanted to sort of recap on what carers originally thought the NDIS was going to do, and it was all about the consumer at the start. So there was access and inclusion for mental health consumers in brackets and carers, because as money is going to be tipped into the NDIS from other sources, we certainly need to have the carer needs right up there as well. An increase in practical supports. I mean, a new scheme must be going to be better, so we imagined it was going to produce a lot more choices, and that's what came out with the choice and control information that came out at the same time, and hope for the future. So I can remember when carers were really excited about mental illness being included in the NDIS. I think there were even T-shirts that we had, and there was all this excitement, but we didn't really know what it was about. So this is why people like me, I think, can help. We're living it now, and it's our role to sort of start to share some information. Okay. Whoops. How do we get that over? Top arrow?
Yeah, I think that.
Did he turn it off? Okay. Oh, that one there. So the carer experience in Barwon, it's varied. What works for some, this is my story, so it has worked for us. My son Mick was quickly accepted into the scheme. I was involved in the planning meetings. He has re-engaged with the community sector and his life has improved. His NDIS plan is a true and realistic reflection of his goals and needs. So that was really exciting to have that positive outcome. Sorry, wrong way. Why was this a smooth transition? Well, Mick, in his mid-30s, has a diagnosis of schizophrenia. He's case managed at Barwon Health, and he sees a psychiatrist every month. So we had no problems obtaining his evidence of disability. And I know that this conference has started to refute the idea that this paperwork was so important, but it's really driven it for everybody. Both his parents are supportive. My husband's very supportive as well. But I've had the advantage of knowledge of the sector. And so I was able to confidently go along with him through the process. And that knowledge of the sector wasn't so much in my peer worker role, it was things that I learnt as being a carer and receiving assistance from places like my fellowship. I went along and did wellways. I learnt things. So it helped me go along and be able to sit in the planning meeting, which I didn't even think I was going to be allowed to go to. As Kevin said in the start, we didn't even know if we thought carers couldn't go along. So just getting in the door was really good. I'm no longer anxious about the direction that Mick's life's taking. because he's not alone in his room all the time. He's out there doing things now. So it's been really good. But there can be pain and hardship for others. One thing about the NDIS, it's all very subjective. Not one person's story is the same as anyone else's. So this is why I think sharing these stories helps. Phil's story is an important one. There was a long delay in getting his son Dan into the scheme. Phil and his wife are emotionally fragile due to their son's poor mental health and the associated problems with drugs. They expected the worst from the NDIS. And this is a bit of a sad thing about the NDIS and carers, is there's not a lot of faith in it sometimes. It was supposed to be this guiding light of hope, but people are quite tentative and frightened about it. The lack of communication from the NDIS exacerbated their anxiety, and they did rely on advocacy from MI Fellowship in Geelong to get them and their son through. They needed extra support. They couldn't have done it on their own. I do have trouble with this sometimes. Okay, let's go back. Okay, why was it a difficult transition? Their son had different diagnoses over the years, the latest being BPD, so there was no clear diagnosis. His GP completed the evidence of enduring disability, and this went along to the NDIS. But at a group meeting for carers, one of the workers from the NDIS actually said that GPs couldn't complete that information. So he actually, threw a spanner in the works and said, no, that won't happen. You have to get a psychiatrist to do it. But this is another thing we've learnt from the NDIS process. We don't always listen to what people say, and we just sort of plough on, and that's what we did. So, you'll hear this and that and the other, but you'll just say, no, that doesn't make sense, so I'm just going to go along with it. So they persevered with the process, and the GP that they saw was actually a really terrific guy. And he said, well, I've done it for other people, so, I don't see why I can't do it for you. So there's a common sense element that comes into it too. And so they persevered, and the outcome has been good for them, but it certainly did take time. And then, unfortunately, for a lot of carers, there's exclusion, and there's exclusion for many of them. And Karen's one of these people. Her son Alan, who's now in his mid-30s, refuses to engage with services and therefore won't go to the NDIS. He denies he has a diagnosis of schizophrenia. He has poor insight, despite having been diagnosed 18 years ago. He manages to live a life, but it's very dysfunctional, and it's quite it's taken its toll on his mum. Untreated, his ability to care for himself is declining, so he's getting physical symptoms of neglect and other associated ill health, which is a testament to living rough and having a hard life. It does put pressure on his mum because she is his sole supporter. There's no other children. His father's died, so it's a lot of pressure. I go back and I go forward. Oh, I'm so sorry. Okay. So what Karen needs. Karen gets anxious and depressed when dealing with the complications and frustrations associated with his care. There's small steps forward. I mean, this is why she hangs in there. But it's not enough to get him into the NDIS and other services. She's an ageing parent in her 70s who fears for his survival when she dies, so this is constantly on her mind. And she relies on support and advocacy from my fellowship in Geelong and from other places just to keep going. So you can see the the cumulative effect of the pressure on carers when things aren't. When all the pins aren't in order, when all the ducks aren't in a row, that's when it's hard, and that's when more services are needed than ever before. Okay, I started off with that beacon of hope, that shining light that we thought NDIS was going to be, because we were told it would be. And now I have to admit it's a bit of a spluttering candle. It has good points and bad, and it shines for some and it sort of blows out for others. So what does the NDIS offer carers? Well, certainly not enough. There are only a few support clusters specifically to assist us with the ongoing stress and challenges of our caring role. There's no support, respite as we know it. I mean, where's the time away? Where's the thing specifically recognising that carers like to have a break? You know, they might like to go away with other people who they feel comfortable with and who they trust. So there's no respite like that in the NDIS. And there's no peer support as we know it as well. So there's certainly room for improvement. None of the carers, including myself, have been asked by planners or the local area coordinators if we need help in any way. So you go along, they're very friendly, they're very inviting, but they don't ask the questions. I mean, and as a carer, I'm used to that, because when I go along to the clinical service meetings and everything, we never get asked about our needs there anyway. So, I mean, this is a chronic situation. So we're not likely to put our hand up and say, what about us? So I did want to just show what, I went through the book with one of my co-workers and we looked at anything in the clusters that had the word carer. And so this is, it may not mean much to many of you, but the support items have all these zeros and numbers. They're sort of quite, long numbers. And so we found 5 of them that have reference to carer stuff. Lifelong transition planning, 2 of them about parenting training, relating to disability training for carers, and behaviour support, family group therapy, training for carers and others in behaviour management strategies. I mean, it's all real sort of, sounds real clinical and real dry. I guess even the NDIS people don't really know what it means. So, but that's the way these things are listed. And I did say 550 support items. I mean, that's just if you count them all. Heaps of them are to do with equipment usage and, they just go on and on and on. But, I mean, it's, if we want to use some figures, we can say 550 support items and 5 for carers. So it's a bit of a weapon, I suppose. Now, we've had a look at other stuff coming out of other areas. We've looked at the Hunter information and everything. We've known all along that we're not the focus of the NDIS. But people like myself and the other people that I work with and help, we will be expected to provide the ongoing informal and unfunded support that is needed for our participants. I mean, that's just a given. We're not going to walk away now. To do this, this is what the Hunter said. To do this, it's imperative that carers' support needs are not left out and are properly addressed in the future, either as part of the NDIS or in conjunction with it. So, I mean, that's really, really important. If we don't start saying that, I mean, they might gallop along and it'll never be addressed. And all the hard work of people that have gone before me, and I'm not a young person, I know people in their mid-80s who've really strived hard over the last 30 years to get recognition for carers, support for carers. My fellowship was schizophrenia fellowship. I mean, it's a real insult if all that work is just thrown out. I think that's really, really horrible. And this is just a bit of extra stuff that we came up with. So we want independent NDIS access for carers. Not all consumers will choose to access the scheme, and that's for sure. They won't. even if carers are heavily involved, we can't make our people go along and do something they don't want to do. We're not going to force them into that. It's not about that. They've got to want to do things. But carers' needs should be seen independently to consumer needs. The clusters need to be changed to retain mental health specific carer respite, not just respite as an adjunct to somebody going away, to a participant going away to the gym or going out for an hour or two. That's not real respite. That's just what other people experience. That's what people experience when their sons and daughters and husbands and wives don't require care all the time. They don't know what it's like for people who are always worried about that. We need peer support from other carers. That's really, really invaluable because it is all about trust. There's lots of times carers can't talk to people. They're too scared to sort of say. They don't know what the reaction might be. The dismissive reaction to people who don't understand what mental illness is. And also important is having a break from the other responsibilities. Looking after carer mental health's vital, or we're going to end up in the system as participants in the NDIS. Depressions and anxiety are really common in carers. So, the government might end up with a few more clients if they don't watch out. Answers about the future of carer support is really important. We need to start to see this information appear. What's the future of Commonwealth-funded carer respite and respite in relation to the NDIS? Carers need answers. It's all, the NDIS started out with not very many facts, and it's only through people who are experiencing it now that we've begun to gather information, but we still don't know what the answers are. We're still at the mercy of people who've deigned not to give too much away. So I'm not prepared to let all that hard work of the people that went before me be sacrificed. I think that would be really shameful. So there you go, carer perspective. Finished early.
You did, good on you. All right, that was a fantastic presentation, Janet. Thank you. I'm just wondering if people have got some questions for Janet. We've got a bit of time.
Oh, thank you. Hi, my name's Tamara. I'm from Bendigo in Victoria, and I'm also a carer. I've been caring for my mum for about 20 years, and she's only in her 50s, so I may be caring for her for another 30. Yep. I also work as a mental health carer support worker, so I am acutely aware of everything you've just talked about. I think one of the earlier talks today, someone mentioned that one of the impacts we'll see in Victoria if the community-funded or community-managed mental health services disappear is a large impact on the healthcare system, but also we'll see a huge impact, possibly even bigger, on families and carers because they provide the bulk of support to people with mental illness. So there are many, many people out there who are not involved in any mental health care at all, and it falls to their families to look after them. And I think we need to acknowledge that it also comes at a time, as you've just mentioned, where carer support is not certain. Carer respite and carer programs are due to end, or federally funded, are due to end in June next year. But I would just like to say that I went to the National Carer Conference a couple of weeks ago, and Mitch Firefield did say that he does consider carer support as separate to the NDIS, and that DSS are starting to, or will start to do early next year, consultations with carers about what that should look like. Yep. They're actually thinking about doing co-design with carers, which is, I think, a positive. But I think if they're just starting consultations early next year, there's not enough time for them to consult and design and roll out a new carer program by June. Yeah. So I think we'll probably just see another rollover of funding. Yeah. I know that's more a comment than a question, but I hope that helps. A little bit more certainty, maybe for another year. Yeah. Not much more certainty, but a little bit.
I did hear about that. It's funny how you just hear things. You know, I did hear about that DSS funding. But consultation can be anything, can't it? You get a bit cynical, you sort of think, they've been talking about it, we know what's needed, you know what I mean, just do it, I think.
Okay, do we have any other, Margaret?
Thank you for that presentation. I just wanted to make a...
Introduce yourself.
Oh, sorry. I'm Margaret Springay, hi, from the National Mental Health Consumer Carer Forum. And I just wanted to make an observation that the stories I've heard from those carers who have somebody with a very serious mental illness and in the receipt of services from Partners in Recovery, it seems to me that there is a slightly different model there that isn't presently included in the NDIS, and that is a pricing problem for relationship building, if you like, that early stage where the services aren't doing a lot, if you like, other than building relationships, which may take a significant amount of time for people with a serious mental illness, and particularly those who lack insight to the fact that they do have an illness. So they're unlikely to accept the service in those, the example of Karen's story. Whereas I'm aware with Partners in Recovery, the service keeps arriving, and eventually, over a significant period, some weeks into a couple of months, the person begins to acknowledge this person that's coming in regularly, and starting that relationship building and that encouragement to move out and undertake other activities, etc. And that seems to me to be built into the Partners in Recovery, which isn't there.
I think it's because mental health was rolled in, so sort of thrown in there. There wasn't the co-design with, like we've just spoken about carer co-design, but I mean there should have been consumer co-design. And it takes time to build up trust and relationships.
And it doesn't seem to me to be funded in place.
No, it's very lean. Very lean.
And care coordination.
My name's Marita Walker. I'm the trial site manager for the Perth Hills NDIA trial in WA. And just 2 points that I absolutely endorse the comments that you've made and the importance of carer roles and the variety of experience that you've seen in Barwon. But just perhaps 2 points to make that we are still trials, so we are learning a lot, and I think that everyone in Barwon will acknowledge that their learning curve has probably been the steepest of all, because they were one of the first 4 to start, and they were the quickest required to take people in through their phasing. So a number of comments today about how things have developed and changed, and that's exactly what we would expect, because we are a trial and things got underway in great haste last year, and as a 2014 trial site, we've benefited a lot from the learning that's gone from those other sites before us. But we still got just over 18 months of a trial period. So we are all still in trial, and every thing that within our organisation is about, we're a learning organisation, and we are here listening for that purpose of being able to hear the feedback and to take that on board. So I appreciate your providing that.
Thank you.
Perhaps one other thing to say is that there is a difference in language, and I acknowledge that, and we would absolutely claim nothing's perfect about our support list. And I understand that Eddie Bartnick's probably talked yesterday about how work on that's being undertaken now to consider how that needs to be looking differently, and I'm certainly have some involvement in that. But within that, it isn't just something that the support list is about. That's what you look for, and you choose off it as a menu. That's not how it's intended to work. And I just want to mention that absolutely one of the key elements of what it is we're thinking about with people's plans is sustaining informal support.
Yes. I just wanted to say, though, that when consumers go along to a planning meeting, they have an hour. I think language is extremely important. I think it has to be as simple and well defined as possible, because people are going along, they have an hour's discussion.
We're not
These cluster idea, a lot of it doesn't quite gel, I'm sorry.
Yeah. Look, I'm not trying to defend everything that's happened or everything that might happen. I'm just saying that we are in a process of learning and not trying to solve everything in an initial discussion, and looking for there to be provision for those things to be provided within the flexible supports that people do get.
But people's lives have changed as a result of the NDIS. So it's happening, you see. It's real, it's out there, and it's happening now. So
that's right.
Yep. Thank you.
Okay, I think we have time for one more question.
Hi, my name is Sage. I'm from the Mental Health Commission of New South Wales. I just had a question in relation to whenever we have a large change and reform, we would want to think that carers return, or the reform would affect carers in a way that you can return to your role of being a parent or a brother or a sister or a wife or husband. So I was just wondering, in terms of the impact that the package has had on your lives or the lives of other carers in the Barwon area, about how maybe some of those items of support that you were previously providing have changed, or your carer role may have changed to allow you to move back to that role of mum.
My son's package is really quite a modest one. I should have said about package size, really, because this is another thing that people out there don't probably get a real understanding of. I mean, his package is about $5,500 a year. Most of it's for group supports, which is what he wanted, and he's obviously benefiting from it. So he's just out there now doing things that just a few times a week with group activities. So it's relieved my pressure. You know, I don't have that anxiousness that I had. I mean, he was just at home all the time, and that was really horrible. But I mean, I guess the changes, I'm out there doing a bit more now, I'm more calm, but the episodic nature of mental illness, you sort of don't ever really forget the worst times in a way. You're sort of always a bit on guard, but I am more relaxed. So I'll go out, and I don't sort of feel I'm worried as much as I was before. But I'm still cautious, and still it's early days yet. I mean, something might happen and he might stop going, and that would be really sad. He knows the importance of it. There's more. Somebody said, well, what do you think the change is? Why is he different? I mean, I haven't really analysed it with him. I'm just so glad that he's enjoying his life a bit more. But he gets it. He knows that it's a commitment on his part now to go along to his activities, that the services aren't just, they can't exist if people just decide on the spur of the moment they're not going to rock up to something, which is what they used to do a bit in the past. So there's more accountability. And I guess he sort of likes that. I mean, he feels that he's doing his bit as well. So, but as far as it's early days. I'll just see how it goes. But we'll see what happens.
Thanks. I think it's important for all of us to understand that the informal supports or whatever you want to call those as that the carer provides sometimes actually should be seen as a role of a support worker or somebody else other than that family member.
So I agree.
As we see the maturity of the scheme, I'd hope that your role and the roles of other carers are closer to that of the relationship that you had prior to illness.
And I like that. I like to be able to step back and be his mum rather than, his carer, so, yeah, that would be great if the NDIS works like that. Good.
Thanks, Chair.
Thanks.
If you could please acknowledge Janet's presentation.